Welcome to a new series of our video tutorials, and this time I would like to talk a little bit about aesthetic cementation, especially with Vitique. I'd like first to give you an introduction into what I'm going to talk about. So I'm going to talk about the clinical procedure. I'm going to introduce Vitique as a material, and I'm going to talk a little bit about Vitique as a system where we not only have Vitique, the material, but also the technical assistance and service and the additional service. And I want to explain what we mean with this. So let's look into the clinical procedure. And the clinical procedure is a 9-minute video, unfortunately only available in German. So I'm going to do a voiceover. I'm going to show you the video. I'll explain everything that Dr. Falman does here. That is important, and show you how he uses Vitique and the try-in paste to cement the veneers. So I want to introduce Dr. Falman with you, and this is now the trial phase. So the first step is that you try the veneers for accuracy in the patient's mouth. So you apply the try-in paste, and it's always that when you put the veneer in, you start with the incisal edge first and then bring it down to the gingival. And Dr. Falman uses a very specialized tool here, not the Optra stick, but a more versatile tool. This is called a LumiGrip, and it's sort of a vacuum system. So it has a silicone tip, you can place it on the veneer, and then it sucks it on, and then you have this little wheel and you can adjust the suction. So the assistant gets the veneer, places the veneer paste, and you see how the tip makes that placement very easy. So you put it on the incisal edge first, and then bring it down to the gingival. So he's doing something interesting now. He's using two different try-in pastes, a B1 and a bleach light. So it's sort of a split mouth design. And he's letting the patient decide which shade she wants at that moment. So you always start, as we said, with the incisal edge first, then down to the gingival. And after all the veneers have been placed, you remove the excess. In this case, it's just a brush, and after that, the patient can decide on which shade, in this case, she wants to go. And it's a very critical patient. She's in the movie business. And actually, and not surprisingly enough, she chooses the whiter shade, the bleach light. So this is something special too that Dr. Falman does. It's now a way of saving time later on. So what he does is he places, during the try-in phase, a liquid rubber dam, like you use it for bleaching, for example. So this is meant to do it at that phase because you know exactly where the veneers will be positioned. And placing this rubber dam here, this liquid dam, seems like a lot of more effort, but it pays back about 5 times when it comes to the accessory removal. Because now when you're protecting all these teeth, then they cannot be contaminated by bonding agent, by cement, and everything is way more easy in the accessory removal stage, and that is something that is an extreme asset when you do this. So all the occlusal surfaces and the palatinal surfaces are protected with this liquid dam. And you'll see later on that it's not only just the liquid dam, you can do a little bit more, but we'll talk about this when we see this. So this step here, and you see when they light cure is extremely short, this is because they have a very high power light. So now you can remove the veneers. And later for the cementation, they will start with the incisors first, and then do one side and then the other side. So this is sort of a compromise between having the most control over the seating of the veneers and having the best experience in terms of speed. So precision is very important, but speed is also, and this is the way they choose it. And These veneers will now be brought to the lab, and the lab will clean them, but not re-etch them, because the etching pattern that they created with the hydrofluoric acid, it's still there. It doesn't need to be re-established, it just needs to be cleaned. And after the cleaning, the lab will also silanate the veneers. And this silanization is being done with the Vitique silane. And the reason for this, that they want this, is that the Vitique silane as a two-component silane ensures that this is the best and most reliable silanization that you can. So what you see here now is an additional little trick. This is a Teflon tape. You get that at the plumbers, for example, and this is something that will help you in any situation that you do bondings. The first step then is to prepare the teeth by etching them for the cementation phase. And this product here is our etching gel, and he likes this because this etching gel is easy to place, it's a nice flowability, it does not flow away, yet you can get it out of the syringe without the ketchup bottle effect. So you press, nothing happens, then you press harder and everything squirts out. So this is a nice thing. And after this etching, for 20 seconds, you will then rinse it off. And after the rinse and drying, you can see how nice the etching pattern has been established. So you can see exactly this chalky white appearance of teeth. Next step is then using the bonding agent. And the bonding agent here is TECO, Total Edge Control. And again, he likes and uses this product because it gives him high bond strength, and it's a nice handling and a reliable bond strength that is an important asset for him, that he doesn't have to worry about this, and the film thickness is very, very low for this product. So after drying, we can now start the cementation process. At that stage, it's better to switch off the operating light to have a reduced light load on the system. So the cementation is very similar to the try-in phase. You fill up the veneer with the Vitique, and then again place it from the incisal to the cervical, and then naturally a lot of cement oozes out, and you do a gross cement excess removal. And he uses a suction tip to do this, also starting from incisal to the cervical area. So now the veneers will be tack cured. So it's a tack and clean technique that he uses. So he places one finger on the incisal edge, one finger on the gingival part, and then the assistant goes between his fingers, is guided between these fingers with the tacking tip, and cures the veneer or the cement through the veneer. So in this position then the veneer is totally securely attached, and now you can remove the excess. And you can see here the gelled up face in this removal technique, and then finally the interproximal areas are cleaned with floss. Finally, you do the final cure, and again this is a high-powered lamp, so this setting of a few seconds cure here does not apply to your lamp. And now when you do the cleanup, you can see this, you can just remove the paint on dental dam, and there's no excess to be done and removed on this one. Everything is already clean. So this is a very relaxed part now, is becoming very easy. The only thing that you might have to do is you use the finest diamond here in the luminaire system to adjust and clean up the gingival part in the cementation here, and that's it. That's everything, and the only thing you do, you just use a polishing strip in between and clean up the excess removal. So now it's time for the patient to have a look at the new teeth and the new smile. And wow, she says, this is a dream, thank you. So this is the result that you want to see. A happy patient with and this is the previous situation. So you can see how much that changed her life and how much Vitique helped in this process. So if you don't want to use this video to explain stuff, we have another video here by Dr. Palmer. This one is in English and it's part of a series that explains a full case, but it's a totally different cementation procedure. So however you have a choice, you can go to the website or to download it from our website. Now let's look a little bit into Vitique. And naturally we want to grow with the products that we offer. And part of that is that we want to grow with innovation. And this is a new thing. We also want to grow by helping people along the way with a lot of assistance. We want to give a lot of support. And this means also that we don't want to address just the users that have been using Vitique already, but naturally people who are not yet in the field of aesthetic dentistry or are not yet using these cementation systems and are not going into veneers. So this is a big issue for us and we want to do something to help people here. Now the Vitique cementation system consists basically of two parts. Part one is this, what you see here. This is the Vitique cementation kit. And the Vitique cementation kit contains basically 3 shades, try-in paste and the tips. So if you compare this, people who know the Vitique cementation kit and how extensive it was, you may ask, okay, this is new, this isn't just new packaging, what has changed, what are the differences? And it's a little bit like with your phones, you know, you get a new generation of a phone and then you find, oh, there's been changes, but there's not only changes, there's also stuff that stays the same. And the things that stay the same because they worked. And for us, the important thing about Vitique that worked was the material itself. It was maybe a little bit complicated and it was maybe a little bit too much. So we shrunk it down, we simplified it, and this is the idea. So it's sort of more of an evolution rather than a revolution. And if we look at the old kit, you can still get everything of these contents, but you have to order it. It's a special card in the system. You find all the ordering information. So if you want a shade that's not originally there, you can still get it. You get everything out of this kit, but in a new look. And the veneer cementation kit is simplified because we found that it basically is 3 main shades that people use. And these shades are the B1, which is a very common shade in veneers, and then the A2.5. So A2.5 is a shade that actually spans A2 to A3. And this is sort of not just the A2.5 as an exact shade, but because of the chameleon effect, you can have this for this range of shades. And then naturally we have transparent, because transparent, if everything is right, is a very common shade to use for the cementation of veneers. Now, we also included naturally, as anyone else does, these try-in shades. And you would assume that the shade match between the try-in shade and the prediction and the simulation of the final cementation would be perfect for everybody. But this is not the case. Actually, with a lot of veneer systems, you find that the shade match between the try-in and the final result differs noticeably. And this is, for example, also the case with Verilink. So even the market leader has problems matching the shade. And therefore, we took great care to ensure that our cementation result really is perfectly predicted by the try-in paste. So in this case, it's a little bit difficult to show a perfect match. But what you see here is we have a shade sample, and in the shade sample, we put the try-in paste. And the thing is that you don't really see that. You don't see any difference. But this is exactly how it should be. No noticeable difference between the try-in and the final result. This is exactly what you want, and this is what you're getting with Vitique. So that's a very important part of the system. Now, I still want to talk a little bit about try-in here, because here you can see all the shades that are available. I want to point your attention to, for example, something that is a little bit special, and this is pink. Initially, when I heard we're going to have a pink shade in the cementation kit, I said, what? Pink? But yes, pink is an extremely important and interesting part. And that is very rare. You don't find this very rarely with other systems. You don't find it with the market leaders. So let's concentrate a little bit on pink. What does pink do? Now, usually when you have a discolored tooth, what the dentist does, he orders a more opaque veneer from the technician. And this opaque veneer will cover the discoloration, but at the same time, the restoration looks a little bit dull, lifeless. And for this reason, we have pink. Pink will give that restoration again a little bit of fire, a little bit of warmth, and make it more natural looking and nicer. Now, we have a group in England that used to use transparent as their main shade. But because this is try-in, they found out that in a lot of cases, the pink actually gives the restoration that special touch, that special kick. And now they're trying routinely also, very often, the pink to see if this doesn't look better. And they can have even the patient decide and involve them in the decision. This is the beauty of having try-in pastes. So that's a good thing. And with these try-in pastes, normally they are made out of a glycerol-based paste. This makes for a good water solubility, so you can remove them nicely with water. Vitique doesn't contain glycerol, because glycerol is also a little bit hygroscopic, which means it absorbs water, it sucks out water from the surrounding, and that leads to a slight discoloration. So it's like a dehydration of the tooth. And we use a different composition that is also water soluble but doesn't produce this effect. So in highly aesthetic cases, even in this respect, Vitique is a little bit better than the competition. Now, in the kit are also these tips. And this is also a very special thing. You don't find this with any other systems. And I want to show you a little bit the advantages of having this tip here. So we have these two videos, and you see here the link, which is very typical. You have to go back and forth in trying to fill up the veneer with the paste, which means you have the slight risk of getting some air bubbles in it, and it's more work than just laying out a nice ribbon of the paste with Vitique. So it's not only more user-friendly, it's also more secure and safely and predictable. So that's what we want. It's also important to have the right viscosity today. And I'm saying this because we are seeing a lot more of no prep or low prep veneers today. And if you look at this here, this is a Luxatemp Ultra or Luxatemp Star Provisional. And you can see that it's very, very thin in some parts. And this is exactly the problem with the viscosity. If the viscosity is too high, you cannot place the veneer safely. If it doesn't flow out, it's very hard to achieve this. So if you place the veneer and the viscosity is not right and it breaks in the seating moment, then everybody has a big problem. The dentist, because he can't send the patient home, has to think about provisionalization and stuff like this. The patient, because he doesn't have the final result yet to go home, and the technician who has to remake this veneer. And actually, in a lot of cases, he would prefer to do the whole series rather than this one veneer and fit it into the perfectly matched result that he already generated. So it is a very tricky situation, and Vitique is one of the few cements that has this right viscosity to let you do this and place these low prep or no prep veneers safely. There's people who have been using Vitique already, and those people sometimes want the possibility to use the special catalyst paste to make this a dual cure system, like with very thick restorations or with mixed situations where you have a crown and a bridge and a veneer. This may be advantageous. You don't have to give that up, you can still do it, but for reasons of simplicity and ease, we have not put it into the general kit. So it is, you can order it, but it's not part of the usual cementation kit that you get. Now, as I said, the Vitique cementation system contains of two parts. We talked now about the cementation kit. Now let's look into the accessory kit. And the accessory kit has naturally an etching gel. And you could say etching gel is etching gel, which is partially true in as far as the performance is concerned. But when it goes to handling, it's actually not the same. So this, if you watch the video with Dr. Falman, is a very nice consistency. It places nicely, it stays in place, and it does not have that ketchup bottle effect. So you try to get it out, it doesn't go out, and then all of a sudden, splash, you have this full part of the etching gel everywhere. So this is a nice viscosity. And then you can also use this naturally for cleaning the veneer. So it's both, it's the etching part and it's the cleaning part for the veneer. As a bonding system, we use Teco. Teco is a single bottle bonding system, so that gives you a low film thickness. Actually, when we measure film thickness of the bonding system with the cement, we don't find any differences in the film thickness whether or not we have the bonding system. So it's very, very low. And we get a very good bond strength, which is important. Veneers are purely relying on adhesion, so that means the topmost and the best adhesion that you can get, this is what you want. And here you can see the comparison with the main competitors, and you see that we make a very good product here that gives you reliably high bond strength. Now, I said that Verilink, for example, uses a single bottle silane, and that's not our choice. We put in, on purpose, a 2-bottle silane. And the reason for this is that a single bottle contains all the reactive components except water. So every time you unscrew the bottle, water enters into the system and degrades the silane. And with the 2-bottle system, only when you mix them, they are there, ready to go, fresh, reactive, and reliable. And this is exactly the point. You want to know exactly that every time you're going a perfect silanization, because the silane is the real thing that makes the adhesion between your ceramic and the cement. And if this is not working properly, you get less of a bond strength than you want. So 2 bottles is more than this. I know that Vitique is not in the top 10 in the US. We would like to see it there, but it's not there yet. However, Reality still already tested the product, and what they specifically noted is that especially the handling is among the best. And when we're talking about handling, there's one thing that is especially important, and that is excess removal. So when we surveyed it and when we handed it out for field testing, we got raving results for the excess removal. And excess removal naturally is a part where handling is most obviously visible. So let me show you a little video here demonstrating the excess removal. And one way to do it is really hit it with a light for a few seconds and then remove the gelled up phase that forms, and this is very, very easy. And you'll see this here in the hands of our dentist, and she's removing the excess here in this highly gelled up phase. So you can just peel it off in one piece, but it's still soft, it's pliable, it's movable. So that makes it very, very easy and nice to remove the cement. And I'll show you a comparison now between this and some other cement. And if you watch, please pay attention. So it's not totally synchronous, but the curing times are the same. So we're hitting it for a few seconds with the light, and then we're trying to peel off the cement. And what you'll notice is, again, on one side the Vitique, which you just seen, nice and easy. On the other side, it's not just soft, it's not just gelled up, it's hard. So if you try to remove this, then oops, actually the veneer has just lifted out. This would naturally not happen in reality. It would be safely bonded to the tooth. But you see that it's hard, and then you just can pry it off. It's not the same thing. It's not as easy and not as nice as with Vitique. So this is a big issue for us to make the product in terms of handling as nice as possible. And this, especially the excess removal, has a lot to do with light sensitivity. So even in under the normal operating light or in pure daylight, a number of cements that are on the market, they harden pretty quickly. So you don't want that because it makes the excess removal so difficult. And the nice thing about Vitique is that it doesn't do this, and for this reason gives you a more relaxed excess removal. And this is exactly what you want. So let's look into the technical service and the additional service that we're giving. Mainly that concentrates on giving people some help, helping them along achieve results easier and faster, and maybe if they're not trained to do this, give them an incentive to go into this. So the Vitique product system is not just a product, it is also the additional technical service, and it is the additional service. And I'd just like to explain a little bit what we mean with this. So you're used to seeing these step-by-step cards in any system by now, basically. The thing here is that these step-by-step cards do not just contain the cementation step, they go beyond that. They go back to even doing a reliable, predictable, and effective veneer preparation. So all of this is dealt with in these cards that you get. So it's more than just the cementation. And this is exactly the thing, the more than just the cementation. So for example, this is from Dr. Palmer. He offered and puts this on the internet, a reliable and predictable method of getting veneer impressions, in this case with honeycomb. So if you want to do this, go to his website down there and download the instructions. And the other thing is that we want to make things easier to understand, and for this we are doing these video tutorials. And it's not just this video, it's also the video by Dr. Palmer, it's the video by Dr. Falman. So there is a number of videos either already existing or that we want to do in the future that will help to understand how exactly this cementation system works. And we're going to offer webinars for almost anyone who wants them to illustrate and to explain these things. So Dr. Falman will do webinars, we will be doing some webinars, and that is a new way of addressing a direct person-to-person thing where we cannot travel to or do this in some other way. So this is something that we want to see more and do more in the future. Also, naturally, we have a number of user reports already either being already done or planned for the future. And this is one by Dr. Palmer, so actually it's not just one, it's a few. This is out of a series of 5 articles where this one is the final one concentrating on the cementation. Then we have here Dr. Etienne, and this one is also available in English or is being made available in English and talks about a minimally invasive approach to do mock-ups and use mock-ups as a cutting template and giving you predictable and efficient preparations. And that's the same technique actually that Dr. Galib-Gurel and others developed in making sure that you get a minimally invasive approach that gives you the best bonding surface and so on and so on. So all of these details are being explained in these articles. This is also by Dr. Gurel and as is this, talking about how you develop the artist within you to do veneers. Now this again is from Dr. Palmer, and this is out of a series that describes different cases. And we have Dr. Falman. And Dr. Falman again is also not just doing videos, he's doing more than this, he's giving even hands-on courses. You can subscribe to one of his programs, and then you'll not just learn how to do the cementation, you also learn how to do the treatment planning, how to do the documentation, how to do the communication with the lab, and everything included. So that's a very good thing. And a part of this, and this is a sort of an additional thing as well, is that we want or do offer a photo course in taking dentistry photos. It's not as easy as you might think originally. It's a lot of things that go into this. So with this photo course, what we want to do is give you more uses for you. You can have a better documentation, you can have a better communication with the lab. So everything here depends on having good photos, and that's also good for the patient. Also, additional value is some things that the dentists that are using Vitique on a regular basis are offering. For example, Dr. Palmer is generous enough to not only talk about Vitique, but in a broader sense, how to do your treatment planning. And he's published a series of articles on this. So this is all giving you ideas of how to treatment plan, how to turn the treatment into a good experience for the patient. And he's even generous enough to put his consent form that he uses and that's legally fine on the internet for download, and to also incorporate into this the laboratory checklist. So this is all additional value that we have for dentists. And I'd now like to talk a little bit about a thing that I would call not just evolutionary but revolutionary. This is something new that is new also for Vitique. And the thing with this is today we're used to going on the World Wide Web and ask Google for anything that we want to know. Now I want to show you a little bit of a different meaning for these three W's. And the first W that I want to talk about is the pocket whirler. And this is actually something that came about from one of our salespersons. And he said, I would love to have a pocket whirler that I can just pull out and ask my question to, and then I'll get this answered. So fortunately, we already have a beta version out for this. So if you want to do this, you can call me on this number and I will answer your questions as to the material. But we can do even better. And what will happen if you call this number, this is a landline number, in Germany. So if you call this, you will get Dr. Falman's assistant. Don't worry, she speaks English. So she will look and see if Dr. Falman is available at that moment. And if he is, he will talk to you right there and then about your issues that you're having or your questions that you're having with the cementation of Vitique. Now, Professor Falman is only a human being. So if he's not there at the moment, he will call you back. But even if he's not available, if he's on holidays, on vacation, then we offer the same number, but in this case not only Dr. Falman will answer your question, but Professor Wainwright, who's exactly the same capacity and well-versed person in cementation with Vitique. And again, he will do the same things that otherwise Professor Falman would do for you. So this is a great new opportunity to get first-hand information right there and then when you need and want it. And this is exceptional because no one else is doing something like this. And lastly, I would say, even if you're not selling Vitique or even if you're not using Vitique, there is definitely a demand out there for people who want nicer smiles, who want better looks, and who are in search for a better preparation technique and a nicer experience all in all. So if you do this, give Vitique a chance and think about all the nice things that you can do and the aesthetics that you can create, the smiles, the happy people. Give it a try. Thank you very much.